Hi, my name is Allison. I currently work as a nurse on Krause's cardiac unit. So I decided to choose CHF or congestive heart failure as our topic for patient education because I care for CHF patients every single day. I am frequently educating patients about their condition during their stay at the hospital. And I also have to go over their discharge instructions when they're ready to leave the hospital. And I have to teach them ways on how to manage their condition at home in order to hopefully stay out of the hospital or have less frequent visits to the hospital. So I chose the Mayo Clinic. It can be found at www.mayoclinic.org. This is a great site for patients to use. Um, I'll scroll down to the bottom here to show you. This is a site that complies with the HON Code of Standards for trustworthy health information. You can click here to verify it. It's valid through April 2022. So that's great because when we're teaching patients on how to find information about their disease online, there can be an overwhelming amount of information thrown at them from the internet, and it's really, really important to choose websites that are safe for them, that are accurate, and we don't want them finding something on wikipedia.com and doing things that we know aren't best practice at home. So for navigating the site, I would tell the patients to go to health information. We're going to go down to diseases and conditions, A through Z, and click on that. So we're going to go to the C for congestive heart failure. We're going to scroll all the way down. It's obviously in alphabetical order. So we're going to go down. Maybe I don't know how to spell. Okay, here we go. Congestive heart failure or heart failure. And there is a link. So you're going to click on that. And it's going to redirect you to patient care and health information on heart failure. So we have the different tabs here that starts with symptoms and causes. A lot of times my patients will ask me, well, why do I have this? Or how did I get this? So it's really good to be able to go over what causes the disease. Um, it makes people better understand like why they have it before they can learn how to manage it. You have to understand what caused this and what they can do to help prevent it from progressing further. Then we have diagnosis and treatment. Patients always want to know, well, how do we figure out if I have this or not? And then the Mayo Clinic is obviously a hospital and a healthcare facility. So you, for some reason, they could see like the doctors and the different departments at the Mayo Clinic. But for this purpose, we're just going to focus on the symptoms and causes and the diagnosis and treatment. So it starts with a quick overview about what heart failure is. The biggest thing that I see for a complaint that brings someone into the hospital is shortness of breath. So it's really important for the patient to understand that CHF occurs when the heart muscle doesn't pump blood as well as it should. When this happens, blood often backs up and fluid can build in the lungs, causing that shortness of breath. Patients often experience fluid imbalances in their legs and feet, which is another way for them to tell that they are not effectively managing the extra fluid on their body. The next we have the symptoms. It discusses shortness of breath with activity or lying down. We always tell patients that if they have to sit higher up in order to sleep at night, then that's a good sign that they have too much fluid on board. If they have to put more pillows behind their head, or if they have to sit up in recliner to sleep, that is a good indication that they need to call their doctor or come into the hospital. So this part right here, when to see a doctor, I think that's probably the most important aspect for patients to focus on, is because they need to know when they need to go to their doctor or they need to come to the hospital. They need to know that when they're experiencing certain symptoms like chest pain, fainting or severe weakness, irregular heartbeat with shortness of breath, or sudden and severe shortness of breath with coughing, white or pink foamy mucus, might be due to their heart failure, but it also could be a medical emergency as well, and they need to get to the doctor immediately. And it also says right here, don't try to diagnose yourself. The patient needs to understand if they're having symptoms that don't make sense and just don't feel right, then they need to come to the emergency room immediately. So this is here, if you have a diagnosis of heart failure and if any of the symptoms suddenly become worse or you develop a new sign or symptom, it may mean that your existing heart failure is getting worse or not responding to the treatment at home. We often see patients who go home on their medications prescribed at the hospital or by their heart doctor, and everything's fine for a few months. And then all of a sudden they start having these new symptoms, a new sign, and that might just mean that we need to adjust what we're doing and educate them further on ways to promote their health. This is another great part too. This may also be the case if you gain more than 5 pounds within a few days. Usually at the hospital we'll tell them if they gain more than 2 pounds in a day or 5 pounds in a week, they need to call the doctor immediately. It's also important for the patient to know that the weight gain is not fat or adipose tissue, that it's fluid. Their body is not effectively managing all that extra fluid. And down here, it talks about the causes. Like I said before, patients really like to know what causes the heart failure in order to better understand it. This discusses the different types of heart failure. So another thing is that heart failure is a chronic disease. It usually only progresses. So when they have these risk factors, it's really important to try to obviously prevent heart failure from occurring. But if they can't, then we need to teach them how to manage it. So some of the high risk factors for CHF is coronary heart disease, if you've had a heart attack, if you have high blood pressure, diabetes. Certain medications can also lead to heart failure or cause heart failure to worsen. That's really important for them to know too. It's important to tell them not to take any medications, even over the counter medications, without clearing it through their doctor first. And this just talks about prevention, because obviously our number one goal is to prevent heart failure. But to help stop it from worsening, we can teach them not to smoke. We can teach them to manage their high blood pressure and diabetes effectively, keep them physically active, educate them on healthy foods and maintaining a healthy weight. So we'll go back up to the top now. And this is diagnosis and treatment. So I would definitely like to stress the treatment part here down a little bit further. Okay. At Crouse We have a best practice like initiative that depending on what their ejection fracture is, it depends on what medications that they should be on. Um, Beta blockers help control the blood pressure, but also slow your heart rate so your heart doesn't have to work so hard. Some Then we have diuretics, or patients know them as water pills, like Lasix that they can take at home. It helps remove the fluid from their body. So there's a lot of medication education to give to your patients too. It's really important for them to know what medications they're on, what they're used for, and why they're so important to take as prescribed. This is just different surgical and other procedures that sometimes people require. We do a lot of ICDs at work. So usually when heart failure is further along and their EF is, I don't know, sometimes we put it in for like 25 to 30%, they'll get an ICD. It's implanted under their skin, and the wires go through their vein into their heart. It basically monitors their heart rhythm, and if they notice a dangerous rhythm or if their heart stops, the ICD will pace their heart and shock it back into a normal rhythm. It's really important because CHF patients are at higher risk for cardiac arrhythmias. And like I said before, heart failure is a chronic progressive disease. So often at the hospital, we take care of patients who are at the end of their heart failure, um, where we have to decide if they want to keep having readmissions to the hospital, or is their quality of life not going to be any better? It's only going to get worse. That's when we get palliative care and end of life care involved to kind of develop a plan and set goals of care. This talks about lifestyle and home remedies, monitoring your weight, limit your salt intake. At work, we tell them to eat or consume less than 2,000 milligrams of sodium per day, limited alcohol and fluids. I have patients who literally drink 4 liters at home and then they come into the hospital frequently. So it's really, really important to stress that their body cannot handle all that extra fluid and they need to limit their water intake, coffee intake. And this is just information about coping and support. All right, thank you so much. I think the Mayo Clinic does a really great job going over heart failure, ways to prevent it. I think this is a really great resource for patients with new diagnosis, even patients who've had a diagnosis for an extended period of time. It gives them a quick overview on what to expect, how to diagnose it, and how to manage it at home. Thank you.